This episode was made possible ad-free by Hill's Pet Nutrition. Let's get into this episode. Welcome, everybody, to the Cone of Shame Veterinary Podcast. I am your host, Dr. Andy Roark. Guys, I got a great one today. Dr. Michael Jaffe is here. He is talking about feline osteoarthritis with me. Guys, this is an area that really does not get enough attention. We don't talk about it enough. We don't do things about it enough. I don't do things about it enough. I think that was a dawning realization on me over the course of this interview. I was like, oh man, I've got to up my game. And I'm making the commitment now. Osteoarthritis in cats is different than osteoarthritis in dogs. The way that we recognize it is it's just not the same. I wonder why I talk so much more about osteoarthritis in our canine patients than our feline. And I get a very clear answer to that question today. And it's just, anyway, this is a great episode about being proactive, about intervention and diagnosis, and also about management and treatment. And so, anyway, this is a great episode. I'm going to stop talking about how great it is. Let's get into this episode.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Cone of Shame with Dr. Andy Roark.
Welcome to the podcast, Dr. Michael Jaffe. Thank you for being here, my friend.
Well, thank you, Andy. Thanks for having me.
I am thrilled to have you. For those who do not know you, you are a boarded veterinary surgeon. You are an associate professor of small animal surgery at Mississippi State University's College of Veterinary Medicine. You have a strong interest in rehabilitation, and you have a new book coming out. You literally wrote the book on feline orthopedics. It's a feline orthopedics textbook. You did the chapter on osteoarthritis. Is that correct? Tell me about it.
I sure did. Yes, sir.
What's the book going to be titled?
The title has yet to be decided, but it is a textbook on feline orthopedics. We have some wonderful contributing authors from all around the U.S. and abroad, collaborating with some fantastic minds, and we think it's going to be a very, very good book.
I was so thrilled because you've got this project, you've got this book coming out. You are the best guy who I could possibly talk to about this. So let me just tell you, I'm going to be vulnerable and honest here with what I'm wrestling with. And so, Michael, I think about practice and I think about the job that I do in the exam room, and I always try to look for areas that I can improve in. And it is apparent to me that I spend significantly more time, probably exponentially more time, talking to dog owners about osteoarthritis than I do talking to cat owners about osteoarthritis. And I don't know if I'm not recognizing, I don't see cats with osteoarthritis and fail to bring it up. Not that. I think that part of it is I'm not hearing about it from pet owners. I wonder if there are things that I should be looking for in the physical exam, maybe beyond what I am looking for. I'm wondering if there's questions I should be asking. And so let me just stop here, and I want to unpack this with you a little bit. You work with a lot of veterinarians and you look at osteoarthritis in cats. Should we be seeing a prevalence that's comparable to what we see in our canine patients when we talk about feline orthopedic disease?
With dogs and cats, osteoarthritis presents in vastly different ways. We see them, they're sore getting up, they're stiff, they limp, they're unable to go up and down stairs, but they still struggle and things like that. But with cats, we don't necessarily see the limping. Yes, they're sore, there's no question about it. But with cats, it's more of a behavioral change that occurs slowly over the course of several years. And these changes are so slow and so subtle that owners don't realize it.
Okay.
I mean, this is just a very gradual thing, and it's just this change in their kitties. And for us as veterinarians who see these kitties on a regular basis, maybe 2-3 times a year at most for wellness appointments and other things, these changes also are so very subtle for us that we don't necessarily recognize them. But the problem is that they're there. And cats are very good at hiding these problems. And for years, we gave them a free pass saying, well, he's just old and she just likes to look out the window at the birds. She used to like to chase them, but she doesn't do that anymore. When unfortunately, the problem is that these kitties can't necessarily do those things. And that if she could, she'd be out there chasing those birds kinds of things. And, we hear all these stories about these cats who for years used to jump up on the kitchen counter and people would try to get them to not do that. And all of a sudden at 10 or 11 years old, they finally learned and they don't jump on the counter anymore. And the truth of the matter is they just can't. And so these changes are very, very subtle. Like I said, they don't just jump out at us on our exam of them. However, we need to be looking for these changes.
When you're doing an assessment of a feline patient that either has osteoarthritis or you suspect has osteoarthritis, what are the questions that you ask the pet owners to sort of help assess where we are in this sort of disease process?
So some of the behavioral changes that we see with kitties are reluctance to jump up on beds or furniture that they used to jump up on all the time, decreased activity, going outdoors or playing. The kitty condos that they have with multiple levels, they tend to stay at the lower levels instead of rising to the higher ones because jumping up and down hurts for them. Some of the behavioral changes that we see are related to litter box use. Think about where the litter box is in most family homes. It's not in the master bedroom, it's not in the kitchen, and it's not in the family room. It's in a remote part of the house,
It's in the laundry closet, yeah.
It's in a laundry, or it's in the basement, or it's in an upstairs bathroom. And so these kitties who are having difficulty navigating to find those litter boxes, or some litter boxes are very tall and they have to jump up and go in those. These kitties have a difficult time either getting to the litter box or using the litter box. And so they start peeing outside the box. And we say, well, geez, he must have a urinary tract infection, or she's got a behavioral problem kind of things. And the truth of the matter is, with some of these kitties, it is due to the arthritis that they just can't do these things. And so those are different things that we will comment to the owners about, asking them. Certainly weight change in the form of getting overweight because they're less active in some cases, or a change in body mass where they lose muscle, but they add fat. And so their weight doesn't actually change, but the distribution of muscle and fat in the body becomes very different for these kitties. And so a lot of these are different subtle changes that do, like I said, occur over many years that owners just don't realize.
That makes sense to me. When you talk about some of these not jumping up, and you also talk about maybe having accidents outside the litter box, how often, Michael, do you think that osteoarthritis gets blamed on obesity? And talk to me a little bit about the interaction of those things. I'm confident that there are people who say, well, she doesn't jump up there, but that's because she's bigger. And the truth is, well, no, it's because there's osteoarthritis. Is that a common sort of misperception that you see? And then also, how do those things interact? Does obesity mildly increase the impacts of osteoarthritis, in your opinion, in these patients, or significantly? Talk to me about how those things sort of come together.
Yeah, I mean, not all of the kitties who become osteoarthritic become overweight or obese. We see that way more in our canine patients because they just can't exercise or do the activity. With the kitties, like I said, they do develop a fair amount of muscle atrophy due to disuse. And they will add body fat. So like I said, they'll lose muscle, they'll add fat, and many times their weight doesn't necessarily change. In other cases, they do tend to lay around more, they're less active, and they do add body fat. And of course, that's going to impact their ability to get up and get around. And the heavier they get, the more pressure they're putting on their joints. So the less inclined they are to want to get up and do more. And so they get heavier and they lose more muscle. And it's just kind of this self-perpetuating cycle of decreased activity, increased body fat, decreased muscle mass. And a lot of times these are changes that impact their day-to-day activity. And so even if they are just laying around doing very little, or not jumping up on counter, or not going to seek out the litter box, those are things that owners don't always notice immediately. The litter box they do, but the decrease in activity and the change in body mass, those occur over months and years, to the point where the owners just get used to these subtle changes. They're not very acute, rapid change where all of a sudden they look and say, oh my gosh, kitty is malnourished or decreased muscle mass or obese all of a sudden. These are very subtle changes.
When you talk about sort of the gradual changes that we see, do you have any advice for helping me to help pet owners to recognize those changes? If I say, has anything changed? They'll often say, oh no, nothing at all. But the truth is, I'm not talking about a month or even 6 months. I need them to sort of look holistically over a longer period of time. Do you have any advice to help them realize what I'm asking when I'm saying, look, I want you to really think back a couple of years? How do you do that?
That's exactly it. You just hit it on the head. Think back to what your kitty's activity was like 3 or 4 years ago compared to what you're seeing now. And almost every owner is going to say the same thing. They'll say, he's older or she's older and she's less active. She's gotten older kind of things. And age is not a disease, but the arthritis is. And as these kitties get older and the arthritis sets in more, those changes do become more prominent and manifest as these behavioral changes. And that's what we're looking at, are behavioral changes in these kitties with arthritis. Whereas with dogs, they are much more obvious acute physical changes where they're limping, or they're holding a limb up, or they become aggressive. They don't want anybody touching them in a particular spot where it hurts, kind of thing. So again, the manifestation of the arthritis in dogs and cats is time related, because with kitties, it's much slower and more progressive. But with dogs, it tends to be obviously very progressive as well. But the changes oftentimes are more acute and obvious, and owners do notice those.
I feel a bit guilty when I diagnose osteoarthritis in a cat because of muscle loss and muscle wasting. It's just my perception that if it gets to the point that I can look at the cat or I can do a physical exam and feel that muscle wasting, then we've probably got pretty pronounced changes, and this has been a pretty prolonged sort of deterioration that has been experienced here. Is that accurate in your mind? Should I feel a little bit guilty when the diagnosis is made on muscle loss? Does that mean that we're probably pretty far along in the disease process?
Yeah, so muscle loss is just one aspect of it. Obviously, we're going to confirm diagnosis radiographically in these kitties. You know, there was an amazing study that was published out of England some years ago where they took 100 cats that were 12 years of age or older. The first 100 cats that came in this hospital, 12 years of age or older. And they radiographed every joint in those kitties' bodies. Of those 100 cats, prior to them identifying osteoarthritis, 4 of those kitties were currently either had signs recognized by the owners or the veterinarians that these kitties were arthritic. Radiographically, they found that 90 of those 100 cats had radiographic signs of advanced arthritis in multiple joints. And so we're missing 86% of those kitties because, again, the changes were so subtle, the owners didn't notice them. And so my goal is to reach out to people to say, be proactive. Look at these older kitties, manipulate their joints. If they're painful, it may not just be a grumpy kitty who says, hey, don't touch me kind of thing, but maybe start looking at these things radiographically and identifying it. Now, one of the things that's come up over the years is, do the radiographic changes that we're seeing in these kitties coincide with the clinical disease, where these kitties aren't showing overt physical signs that the arthritis is bothering them? But yes, radiographically, we're seeing these, these multiple arthritic joints. And it really comes down to the fact that cats really do just hide these things well. So my goal in reaching out to veterinarians is to emphasize them to be more proactive. Look for the arthritis, because if you're seeing a 12-year-old cat in your practice, there is a 90% chance that kitty has osteoarthritis. Now, let me roll it back a little bit further. Same study, different group cohort of kitties, but they took all these kitties that were 6 years of age or older and radiographed them. Same thing. And they found that 60% of those cats were arthritic. Now, a lot of those were the much older kitties. So the likelihood that these kitties, even at middle age or kind of late in the single digits when they get up around 10, the likelihood that arthritis is progressing and is there is actually very, very high. And a lot of these kitties aren't showing those classic signs that we think of in dogs, but I think we just have to retrain our brains to look at cats and think about the changes and the signs that we're seeing in a very different manner.
I like this a lot. Let me ask you sort of the elephant in the room question. When we get more proactive in intervention and we start to radiograph these cats and we say, aha, this 6-7-year-old cat is already showing signs of osteoarthritis. Michael, I think a lot of people want to know what are our options for treatment and management of these cats, especially if they're obese. But let's just start with our regular feline patients. Let's say that I am more aggressive. I'm listening. I'm asking these questions about the longer term changes in behavior, and I have strong suspicion, or I'm even able to radiographically confirm that we've got osteoarthritis. What are your sort of treatment management steps that I should be starting to implement, and kind of what does that look like?
When we treat a cat with osteoarthritis, it's exactly the same way that we would treat a dog with osteoarthritis. We're talking about multimodal management. We're talking about making use of nonsteroidal anti-inflammatory drugs as needed for pain. And again, I just don't put them on and say, here, give this twice a day for the rest of their life kind of thing. I like to treat them the same way that, if you or I had any back pain. You take an ibuprofen when your back hurts. You don't take anything when your back feels fine. And that's the same way I approach these kitties, is to use a nonsteroidal on an as-needed basis. Now, we're kind of limited with our nonsteroidals that we have that are approved for use in cats, but they still can be used on an as-needed basis. So that's the first part. Looking at joint supplements, glucosamine and chondroitin sulfate supplements. You're looking at omega-3 fatty acids for a kitty. I'm a big believer in both of those. And I know that the science in some of these may be questionable or lacking. But what I've found with dogs, at least, is that when I put them on a glucosamine supplement, and owners don't always necessarily notice a difference until they take them off the glucosamine, and all of a sudden they seem different. And so that's the same thing with any supplement. It's kind of like me taking a multivitamin every day. I don't feel different after I take it. But I take it because I know it's good for me and it's good for my body's overall health. And that's the same way I look at any of these supplements, is that despite the fact that there may not be some hard scientific evidence, there at least is enough body of evidence to show that when they're on these products, they seem to do better. Looking at weight management and exercise, those two always go hand in hand. And for me, weight management is by far the most important component of the multimodal management that we deal with. And so making sure that these kitties do maintain a normal, healthy body weight, I think, is paramount. But with, like I said, with diet comes exercise, and we still need to make sure these kitties are getting exercise. And so it's hard for us to put a leash on a kitty and say, come on, let's go for a walk. That's just not going to happen. But we do have ways of engaging with our kitties and giving them some exercise by playing with feathers or playing with other toys or using the laser pointers and getting them up and interested and active. They will burn their calories in those regards. We do a lot of physical therapy and rehab here at Mississippi State for animals that are overweight or with chronic osteoarthritis to try to improve range of motion of their joints and try to stretch out any muscles that may have developed some contracture due to decreased use, and work on weight management for these kitties. So again, the whole multimodal management picture for cats is exactly the same thing that we do with dogs.
This definitely makes sense. Can you talk to me a little bit in more detail about how you leverage things like glucosamine and chondroitin, and especially the omega fatty acids and things like that? What does that look like as far as a treatment regime? How do you sort of explain it to the pet owners?
Obviously, giving a cat a pill every day is not something that anybody wants to do, whether you're in the veterinary field or not. But there are some supplements that are chewable, that are very palatable for cats. And in fact, my wife's a veterinarian here at Mississippi State as well. And after she brushes our dog's teeth, they get a dental treat. And after she brushes our cat's teeth, our cat gets a chewable glucosamine treat. True story. And so that becomes her reward for getting her teeth brushed. And there are some very palatable products out there for giving them glucosamine on a daily basis. If it was a 6-year-old dog with arthritis, we wouldn't think twice about getting them on a glucosamine supplement. So why should we think any different with cats? Now, with the omega fatty acids, I do recommend those. I do feel omega fatty acids are very good products in the sense that what they do is they substitute in on the cell membrane for the synovial cells. They substitute in for the omega-6 fatty acids, which are easily broken down, and it leads to the inflammatory cascade. With the omega-3 fatty acids, they break down a little. It's a little harder for them to break down. So technically, we get less inflammation. And even though I know we don't consider them preventative, in my mind, that's how I kind of think using omega-3s are, is that they prevent long-term osteoarthritis.
What is your favorite strategy for managing obese cats? You talked about play, things like that. Do you have guidelines for pet owners of how you sort of coach them? Do you give amounts of play? Or are you a big fan of weight loss diets? What are the approaches that you take?
It's a very easy math problem. It's very easy to calculate. The more calories you burn, if you burn more calories than you consume, you're going to lose weight. So getting them engaged in playful activities and reducing or putting them on a diet cat food that has a lower caloric density. Again, at that point, we have to make sure that they are either burning more calories they consume or consuming less calories. Now, I don't want to deprive the kitties of their meals, but there are some very palatable diets. Hills has some very palatable diets, especially for cats, for weight management. And I think those are valuable, especially diets that are supplemented with glucosamine, chondroitin sulfate, sulfate and omega fatty acids. There's a lot of value there in that. Again, it may be just one less supplement that you have to give your kitty if it's already formulated into the diet. Those are kind of nice, but it does take a little bit of effort to make sure the kitties are getting their exercise every day, because when we're home at work, they're resting, they're napping. But when we come home at night or on weekends, it's important to engage with the kitty, get them playing, getting them up and moving around, and hopefully allowing them a little exercise time.
What is one way that you handle these cases now that you did differently, say 5-10 years ago? What have you changed recently?
I think it simply is the recognition that cats are more arthritic than we ever assumed they were, because for years assimilated the signs that we see in dogs to arthritis in cats. And when we didn't see those same signs in cats, we assumed that they weren't arthritic. And again, we gave them that free pass over all these years, saying that kitty's just getting old. So I think now what I do differently is I do look for it. And I'm more active in terms of manipulating or, assessing these joints. And when they are painful, not just saying, well, kitty is grumpy, she doesn't like me doing that. Doing range of motion checks and checking. And again, because I do a lot of rehab as well, I do a lot of goniometry to measure joint angles. But again, noticing when these joints have lost some range of motion. And some of those times are due to muscle contracture or muscle fibrosis, where they just don't stretch those muscles as well as they used to. It's kind of like any of us, if we go jogging and we haven't run for a long time, and the first time you stretch those hamstrings, boy, they're tight and they burn. And it's because we haven't used those muscles appropriately in a while. Well, the same with these kitties who are less active. And so that's where physical therapy and rehab comes into play. And when we can stretch those joints out and when we can get the range of motion improved, those kitties are going to be more active, and they will then burn their calories a little bit more efficiently. So those two go hand in hand. But again, recognizing, I think, looking for arthritis, which again, given, as the age climbs, the likelihood that it's there certainly becomes higher, and assuming that they're arthritic and taking the steps, even if owners don't want to sedate and get radiographs. And if I've got a 9 or 10-year-old kitty and they're starting to display some of this behavioral changes, if nothing else, I can at least start them on omega fatty acids, glucosamine supplementation, make sure that the owners are monitoring their body weight and their exercise. And certainly, yes, approach them with an NSAID, on an as-needed basis. Of course, I'm going to always check their blood work first and make sure, that those things are going to be safe for them. But again, looking at these approaches with a very high positive confidence level as these kitties get older. Radiographs are great to document it, but if we're seeing those changes, then our confidence level is quite high that they're arthritic.
Dr. Michael Jaffe, this has been fantastic. I really appreciate you taking time to talk with me.
Thank you.
Aside from your upcoming book and book chapter on feline osteoarthritis, what are your favorite resources for people who say, hey, I'd like to learn more about this. I'm interested in rehabilitation and managing these patients better?
Hills Veterinary Academy has some wonderful links there that people can look at. There's a lot of great information on that website. It's just a fountain of information. There's a lot of good webinars that I get advertisements for that I attend online. Certainly, some of the journals have some really good review articles in some of the vet journals that we all get. And so the information is out there. I think we have to look for it, just like how we have to look for arthritis in our kitties, but it's out there and it's not too hard to find. So our hope is that when our book comes out next year, that we will at least provide a little bit more information for people who are seeking that, and hopefully it'll help the kitties in our community.
Outstanding. Well, thanks for being here. Guys, thanks for tuning in, everybody. Take care of yourselves, gang.
Thank you.
And that's it. That's what I got for you. Guys, thanks so much to Dr. Michael Jaffe for being here and sharing his knowledge. Thanks so much for Hills Pet Nutrition for making this episode happen. If you guys have not checked out the Hills Veterinary Academy, it is such a great learning platform. There's just really good information there. It's definitely worth your time to have a look. Guys, I'll put links to everything down in the show notes. Take care of yourselves. I'll talk to you later on. Bye.